Hey everyone, and welcome to this Essential Clinical Explainer. I am incredibly glad you're joining us today because we are going to master a really critical medical breakdown: how to identify and manage dengue fever right from your home. We're going to build a comprehensive, step-by-step foundation of knowledge today. That way, if a sudden fever strikes, you aren't just guessing. You are acting with absolute clinical precision. Our goal is super simple: to arm you with the exact science and the structured protocols you need to navigate this illness safely and effectively.
And look, the need for this knowledge is incredibly urgent right now. During the mid-year monsoon months of June and July in 2026, medical records confirmed that over 59,000 patients faced an active dengue diagnosis in literally just a 2-week span. This was particularly surging across the western province. So we are talking about an alarming spike in a major tropical viral infection. This isn't just some distant statistic, right? This is happening right in our neighborhoods. And that means every single household absolutely needs a clear, scientifically grounded game plan.
Okay, let's dive into this. Here is the chronological survival guide we'll be walking through today. Number 1, the 2026 emergency and dangerous myths. 2, symptoms and fatal mistakes. 3, the critical testing timeline. 4, decoding your blood tests. And finally, number 5, survival hydration and diet. All right, starting right off with Section 1. The 2026 emergency and dangerous myths. The absolute first step to successfully navigating a dengue infection is clearing away the noise. You know, in times of medical crisis, fear often drives people toward unscientific, dangerous household remedies. It gives them this false sense of security, and worst of all, it delays actual life-saving clinical care. A perfect example of this actually happened back in 2022. Based on this widespread piece of misinformation, a father was told that keeping peacock feathers near his sick child would magically restore crashing blood cells. Believing this myth, he delayed taking his kid to the hospital. By the time medical professionals finally intervened, the child's platelet count had plummeted from a completely safe 142,000 all the way down to a critical 34,000. Superstition simply cannot cure a virus. The medical reality here is that relying on myths delays essential hospitalization, and that allows vital counts to plunge dangerously low. To beat this disease, we really have to understand the vector. The culprit is the Aedes mosquito. You can easily spot this insect by the stark, striking black and white stripes across its body. The infection kicks off the exact moment this mosquito injects its virus-laden saliva directly into your bloodstream. But here is the absolutely crucial environmental fact. Unlike other pests, the Aedes mosquito breeds exclusively in clean, completely stagnant water. They don't want dirty gutters, no. They want the pristine rainwater collecting in discarded tires, uncovered containers, or those little garden pots. So your best defense is source reduction, emptying out those pools of water around your home and applying dry sand so they literally cannot multiply. Moving right along to Section 2, symptoms and fatal mistakes. Now, if a fever actually does strike, how do we identify it? Well, dengue can be surprisingly deceptive. While we often expect a standard set of symptoms, dengue can present really atypically. A patient might just have cold-like symptoms, or they might get intense, severe stomach pain, or maybe these debilitating headaches localized specifically right around the forehead and right behind the eyes. Because these symptoms can be so broad, the single most urgent action you can take actually has nothing to do with medicine. It's about documentation. Timing is everything. You absolutely must write down the exact date and the exact hour your fever begins. If it starts at 9 a.m. on a Tuesday, you write that down. Why? Because the life-threatening phase of dengue, which is the fluid leakage phase, happens on a highly predictable biological clock. If you don't know exactly when that clock started ticking, doctors literally cannot accurately predict when your body will enter the critical danger zone.
So the crucial point is knowing the difference between safe relief and a fatal mistake when managing that early fever. You must never take NSAIDs. Those are non-steroidal anti-inflammatory drugs, like mefenamic acid. And you should never take steroids, like prednisolone. These medications are strictly prohibited. If you take them, they can trigger catastrophic internal bleeding and accelerate fatal plasma leakage by day 3. It's just not worth the risk. If you have a fever, stick to standard paracetamol and consult a verified doctor immediately. Whatever you do, do not risk unprescribed symptom relievers.
Which brings us to Section 3, the critical testing timeline.
Once that fever starts and you've got your time logged, you need to follow a strict, life-saving chronological testing protocol. Panicking and demanding the wrong blood tests at the wrong time is only going to give you a false sense of security and honestly drain your wallet.
So here's the exact timeline you need to memorize. Day 1, the very first 24 hours of your fever. The only test you should take is the dengue NS1 antigen test. Taking a full blood count, or FBC, on day 1 is completely medically useless and a huge waste of money, unless, of course, you're pregnant and a doctor specifically needs a baseline. Okay, day 2. 0 tests are recommended, just rest up and hydrate. Then, day 3. This is when things get serious. After 48 hours have officially passed, you must get a full blood count and a CRP test.
Just jumping back to day 1 really quickly, it's super important to understand the tool we're actually using. The NS1 antigen test isn't 100% foolproof, okay? It can occasionally throw a false positive. However, it is the only reliable early indicator that can catch the virus's presence during that super brief first 24-hour window. It gives your doctor the critical early warning they need to monitor you closely before you enter that rest period on day 2.
Let's move to and see how this builds into Section 4, decoding your blood tests. Okay, so we're entering day 3, and this is when you finally get your full blood count back. And look, you don't need a medical degree to understand these results. You really just need to know which 3 markers to check. First up, check your WBC, your white blood cells. A normal range is 4,000 to 11,000. In dengue, this count will drop below 4,000, maybe hitting 3.8 or even lower. Next, look at your platelets. Normally they sit pretty between 150,000 and 450,000. The dengue danger zone is when they drop below that 150,000 mark. Finally, look at your CRP. Because dengue is a virus and not a bacterial infection, your CRP will actually remain completely normal. So let's put that together. If you have a high fever, dropping white blood cells, dropping platelets, but a perfectly normal CRP, that strongly indicates dengue, and it requires immediate professional medical attention. But wait, there is one more critical marker on your day 3 blood test, and that's your hematocrit, sometimes labeled as PCV. Hematocrit is simply the volume percentage of red blood cells in your blood. In a healthy body, your hematocrit number should naturally be exactly 3 times your hemoglobin level. Grasping this specific medical concept is literally your key to identifying the fatal plasma leakage phase before it's too late. And this brilliantly illustrates how we calculate the danger zone using just simple math. Step 1. Find your hemoglobin number on the test. Let's just say it's 10. Step 2. Multiply that by 3 to find your baseline hematocrit. So, 30. Step 3. This is the clinical red line, guys. You watch that hematocrit number. If it increases by 20% from its baseline, for instance, if that 30 shoots up to a 36 or higher, it signals that the water in your blood is actively leaking out into your tissues. This is dangerous internal fluid leakage, and it means you are entering severe clinical shock. Finally, let's look at Section 5, Survival, Hydration, and Diet. So how do we actually fight back against this fluid leakage at home while under a doctor's care? This brings us to our final, highly prescriptive step on at-home symptom management. Getting your hydration right is quite literally a matter of life and death here. Let me ask you a question that might actually shock you. Why can drinking plain water be fatal during a dengue infection? I mean, we're always taught to drink plenty of water when we have a fever, right? But with dengue, that common assumption is a massive trap. Here is the reality of the situation. Plain water lacks the essential salt and electrolytes your body is desperately craving. Drinking vast amounts of plain water can actually worsen the plasma leakage into your tissues, rapidly accelerating the shock phase. On top of that, soda, carbonated drinks, and tea are incredibly dangerous. They can induce vomiting and cause even further dehydration. For genuine survival hydration, you must rely exclusively on electrolyte-rich fluids. We're talking about things like rice congee, nutrient-dense vegetable or meat soups, and non-citrus juices like apple or mango juice. Those are the only safe options to maintain your blood pressure. To understand why this diet has to be so strict, you really have to understand the mechanics of the danger phase, which usually strikes right after day 3. Because water is leaking into your tissues, your blood loses vital volume and becomes thick. Your heart physically struggles to pump this thickened blood throughout your body. This cascade is exactly what leads to dengue shock syndrome. During this window, your white blood cells and platelets are just continuously dropping. But here is the good news. You are waiting for a very specific clinical trigger. The reversal of the disease actually begins the exact moment your white blood cell count naturally starts to rise again.
Yes, the moment you see that WBC shift, let's say it's climbing from a scary 2.9 back up to a 4.5, the recovery phase has officially initiated. Soon after that, your platelets will stabilize and they'll start to climb as well. Once this happens, your doctor will finally be able to confirm that the clinical danger has passed. Strict hydration with electrolyte fluids and disciplined medical monitoring through this critical window is the proven scientific path to surviving this illness.
Which leaves us with one final, totally vital question to consider today. If a sudden fever strikes your family tomorrow morning, will you be ready? Will you remember to grab a pen and log the exact hour it begins? Will you bypass those crazy myths, avoid the dangerous medications, and confidently follow the strict 3-day testing and hydration protocol we've just laid out? By applying this structured clinical knowledge, you now hold the power to protect yourself and your loved ones. Stay informed, stay vigilant, and use this framework to stay safe. Thanks so much for joining me on this explainer.